for lateral tracking patella.
Okay, so when we start taping you, I'm gonna mark the borders of the kneecap. I'm finding the inferior border of the patella, so it's flipping up into my hands here as I press on the superior border. So I'm gonna make a mark down here, and then I'm gonna find the medial border. The patella is in the shape of a hexagon, kind of like a stop sign. So we're gonna find the superior border. I can do that now by pressing on the inferior border. It flips up into my hand. And then here, so Dr. Roth's patella is tracking over here. It's too far tight. Your IT band is very tight over here, and the VMOs are weak. So we're going to really try to give the body some cueing to bring the patella more medially. So we'll start with our first piece of tape.
So you fold it in half?
I cut the tape already. 2 similar sizes of tape. I rounded the edges to help it adhere better. And what we're gonna do is I fold it in half, and then I pull the kinesio tape like this. I flip back the paper, and I am going to find my lateral border here. And what we're gonna do is I'm gonna put no stretch on the kinesio tape here and just anchor it down. And then what I'm going to ask Dr. Roth to do, Dr. Dan.
Dr. Dan.
I know. What I'm going to ask Dr. Dan to do is to bend his knee. So try to bring your heel towards your buttocks.
Wish I could.
Okay, that's good. And normally, if you were one of my regular patients, I would be having you lie down, so everything was at rest. And I'm making a C shape. And so I gave about a 40% pull, and then I'm rubbing over here to get it adhered down. Same thing over here, I'm letting it go. There's no pull at the end. The only pull is in the middle, and this makes a nice C shape, and it's going to help the patella align. And then, Dr. Dan, can you straighten out your leg? And now I'm going to find the medial border. I'm going to put less of a pull here. I'm just going to help to keep it stable so it doesn't pull too medially. And again, I'm putting an anchoring down on the medial border. I found my little medial border line. Again, Dr. Dan, can you bend your knee? And I'm going to give it a slight pull, about 20% pull. And then the edges here have no pull on it. They just anchor down. Same thing up here. And sometimes people call this the Coco Chanel taping because it's a double C. And that is how you tape somebody who has some patellofemoral pain or patella tracking issues. And we're just rubbing to help the tape adhere because the tape responds to heat. So you would tell your patient not to blow dry the tape.